Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower left second premolar, and our kind doctor has been suspecting a fracture in this tooth. Now, this is the coronal view of the tooth. On the coronal view, we can see that there are voids in the obturation, but we don't see any major fractures in on this particular segment. This is the sagittal view. On the sagittal view, we can again see voids present associated with the obturation, but we don't see any major cracks propagating from within the tooth. The other significant finding that we see with cracks is a J-shaped radiolucency or a periapical radiolucency, which is not associated with this tooth either. We do see that there is a periodontal defect on the mesial aspect associated with the implant on the medial. The implant itself is very stable. The crown is stable, but because of the implant depth, there is a bony defect which is associated and could be a periodontal problem with this particular tooth. On the axial view, this is the axial view. We can clearly see that there is no major cracks associated, but there is a line. This could be a radiographic artifact, but it will also be the voids that are present. This line is not associated with any periapical radiolucency or any J-shaped radiolucencies. In fact, we do see a little bit of thinning here, but that is cortical plate, the cancellous bone as well. So our conclusion is that we don't see a very conclusive evidence regarding the presence of a fracture. This is down to 150 micrometers. But if the distal aspect is where the patient is finding problems, we do see a line on the axial view right here. And if it is the mesial aspect where we can see a little bit of a PDL thickening, this could be a periodontal lesion. We're willing to listen to the clinical symptoms and we can discuss with the doctor if there are any findings that we can correlate with the clinical scenario. Thank you very much.